Hey everyone, Drs Huffman back to talk a little bit about the traditional medical approach and its pros and cons. Pretty much everyone that walks through our doors with neuropathy has experienced the way the traditional medical model approaches neuropathy, which is with medications. So let's take a little bit of a deeper look at that.
Statistically, 90% of neuropathy sufferers are relying on medication or injections to manage their neuropathy. We all know those are not really ideal long-term solutions. The conventional approach to neuropathy typically goes a little something like this. You go into the doctor, you get prescribed medication. You wait until the condition gets worse, then maybe you have the dose increased. Wait until it gets worse again, then maybe add in another medication. Wait until it gets worse again, and then you really have to add in the really heavy pain medications. Then it gets worse again, and as a last resort, you have amputation. This goes on and on until the patient is pretty much completely debilitated. Common medications include gabapentin, Neurontin, Cymbalta, amitriptyline, and heavy-duty pain meds, and many who are taking them have been on them for months, even years. As a home health PT, I saw patients all the time with varying doses of each of those medications. And in fact, we've seen trends for those medications significantly increasing over time.
Yeah. In the United States, we have what's called a symptom care system, meaning that for every symptom, what do we have for it? A medication. We've created a system that is fundamentally a reactive system, and it seldomly addresses the underlying causes and more often treats the symptoms with medication. Did you know that one of the most commonly prescribed neuropathy drugs, Neurontin, commonly known as gabapentin, was not even designed to treat peripheral neuropathy? Generally speaking, 20% of drugs are actually prescribed off-label, meaning they're designed or proven effective for one condition but is used for other conditions. The use of gabapentin has become so widespread that as many as 90% of prescriptions are for off-label uses, such as the treatment of peripheral neuropathy. Speaking of gabapentin, it's not actually FDA approved for peripheral neuropathy, even though it is commonly prescribed to treat just that. It's actually FDA approved for seizure disorders. It does work for neuropathy in the sense that it does calm down the nerves, decreasing pain levels. As the dose increases, so does the calming effect, but also so do the side effects. We are never going to tell you not to take your medications. Of course, there is a time and a place for them. You need to be able to take the edge off so you can go to work, enjoy time with your family, go on walks, or even be able to sleep at night because you hurt so bad. If that's the case for you, then please, by all means, keep taking your medications until you figure out a better solution.
Because as it turns out, our current healthcare model struggles to manage, let alone correct, chronic issues. The hospital and medical systems were built on an acute care model, meaning that if you have a broken arm or have a serious accident, the medical field is the best that there is. However, once you transfer into the chronic disease, insurance in the medical field begin having significant difficulties handling it. Medicare itself has a rule that states this: a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent the deterioration of chronic disease and conditions, are deemed not medically necessary. Okay, let's say that one more time. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent the deterioration of a chronic condition, is deemed not medically necessary. And if Medicare doesn't pay for it, then the doctors don't usually have access to it, often leaving the patients and their physicians in a really tough spot. And this goes for essentially all healthcare coverage. To sum it up, if you have a chronic disease, doctors can rarely focus on preventing you from getting any worse, let alone correcting what the actual root cause of that disease is.
Right. But enough doom and gloom. we think medical professionals are wonderful. We have close friends that are medical professionals. They are who I want to see and Olivia wants to see when we get really hurt.
Absolutely.
In an accident, have the flu. They really are wonderful people, and they are doing absolutely everything in their power to help. They're just provided a limited tool bag to do such as that, mostly because of insurance and just the systems that are provided. But when you have a chronic illness, it might be time to start thinking outside that box. If you want to find out more, catch our next video on our approach to treating neuropathy and why you do have hope. Thanks, guys.